Sushruta for NEET is now available on the Google Play Store. Try it out for free.
Good evening, everybody.
Good evening, sir.
I hope you see the screen.
Yes, sir.
Please mute yourself. So, in today's class, we shall study about the sexually transmitted diseases. Sexually transmitted diseases are otherwise abbreviated as STDs. And it is very much required that it is the people of your age, you should know more about these diseases. I will tell you why. Your age is like this. You wanted to learn everything by doing experiments. You will not be satisfied with the knowledge of others. You want to do and learn. Therefore, at this age, which is very, very crucial, very, very diversified in a different interests, one must be very much careful about this particular disease, what is the sexually transmitted diseases. Diseases are infections which are transmitted through sexual intercourse, which are transmitted through mating or copulation, are collectively called sexually transmitted diseases or STD or venereal disease, VD, or reproductive tract infections, RTI. This RTI is not a right to information. If at all it is asked what is the full form of RTI in biology, you have to write reproductive tract infections, not a right to information. Always ask a question, what is STD in the board examination? Give examples for this. Gonorrhea, Syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course HIV. These are all some of the examples for sexually transmitted diseases. You must know very well. And in your syllabus, there is no much mention about these diseases. And if the time permits, let me just show some slides pertaining to this also. Let me give you a little bit of information additional pertaining to this. So, among these sexually transmitted disease, HIV infection is most dangerous, and you are going to study it separately in the chapter 8. So, all these examples you should by heart. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and also you should know, out of these, which are all bacterial diseases, which are the viral diseases, which are the protozoan diseases. Let us see. Some of these infections, like hepatitis B and HIV, can also be transmitted by sharing injection needles, surgical instruments, etc., with infected persons, transmission blood, or from an infected mother to the fetus. So, apart from coming in contact with the STD individual sexually, otherwise also, you can get some of these diseases, infections, especially hepatitis B and HIV. It can be transmitted simply by sharing the injection needle, surgical instruments, or even sometimes razors with infected person. Or even it can be transmitted during the transmission blood. If at all, the blood of the person who is suffering from STD, is donated to a healthy person, that person also may get this STD. Or it may be passed from infected mother to the fetus also. Except for hepatitis B, genital herpes, and HIV infections, other diseases are completely curable if detected early and treated properly. This is very important. Most of the time, these diseases are not detected early. They are not treated properly. What is happening? You know, I'll show you some of these examples later. Whenever a girl suffers from STDs, most of the time she will be asymptomatic. Asymptomatic. She will not show any symptoms externally. She will not show any symptoms. Infected females may often be asymptomatic and hence may remain undetected for a long time. That means the girl, the woman herself, she will not be knowing that she is suffering from these STDs. Now let us think that a boy has come in contact with a girl sexually, and that boy has STD, and this is passed to the girl. In a girl, symptoms are not seen. She may remain asymptomatic. Now, let us think that that girl is going to get married to another boy. What will happen? This, her husband, is going to get this disease because of the wife. And her child will get it. She is asymptomatic, but she is positive for these STDs. Therefore, it is very, very dangerous. And many times, the boys start developing symptoms. It is not that girls will not develop symptoms at all. She may also get symptoms. Most often asymptomatic, but sometimes she will also get the symptoms. Now, if at all a boy gets the symptom of this STD, can he tell the parents that I got some symptoms, I got something problem? And he'll be scared to tell it to the parents because he knows very well that he has contacted someone sexually. Let us see that the boy who has not married, unmarried person. If at all unmarried man gets this, he cannot tell it to the parents. And more than that, there are certain symptoms which come and vanish. And the boy thinks that nothing has happened, I simply worried. But again it comes, again it vanishes, and later, after 20, 30 years, it will be a permanent. So, many times this will get to know only after one gets married. Prior to that, they come in contact with the sex, come in contact with the individuals, with the sex, and the symptoms are not that much of prominent so as to go to the doctor. They neglect it. But when it goes to the no return stage, it will be too late. Therefore, one has to be very much careful. One should be very much careful with regard to these diseases. Early symptoms of most of these, that is, whatever you have heard about that, sexual transmitted disease, like gonorrhea, syphilis, etc., etc., early symptoms of most of these are minor. Include itching, fluid discharge, slight pain, swelling, etc., in the genital region. And this itching or this fluid discharge, pain, swelling, etc., it gets cured on its own. Then the boy thinks that, oh, I simply unnecessarily worried. And after another 6 months, again it may come. I'll show you some of these stepwise events later. I hope you understood this point. Is it clear? Any doubt?
No, sir.
No. Prathviraj, are you there? Prathviraj. Absence or less significant symptoms in the early stage of infection. Absence or less significant symptoms in the early stage of infection. And the social stigma attached to the STDs deter the infected persons from going for timely detection and proper treatment. Those who have made mistakes, they will be knowing very well. The boy or girl who have come in contact sexually, one of them is in the STD. Of course, boy will not be knowing that the girl has STD, or girl will not be knowing that the boy has STD. But ultimately, because of coming in contact with one another, either from the boy, girl will get, or from the girl, boy will get. But after that, symptoms started developing. Because of the wrongdoing, they fear to go to doctor. They fear to tell it also to the parents. And that makes that timely detection and proper treatment is not given. This could lead to complication later, which include pelvic inflammatory diseases, PID, will be asked for full form. In case of women, abortions, stillbirths, ectopic pregnancy outside the uterus, in the oviduct or in some other area. Ectopic pregnancy outside the uterus. Your fetus should develop inside the uterus. But in ectopic pregnancy, the fetus develops outside uterus. Infertility, not getting the children at all, or even cancer of the reproductive tract. This may all lead, or this may all come into effect if at all one gets the STDs. Right? Pelvic inflammatory disease are the diseases concerning the lower abdomen. Abortions, stillbirth, birth before the actual expected time. Right? Premature birth, stillbirth. Premature birth is the baby is born, it may be alive. In the stillbirth, the baby may die. It will be born dead. Ectopic pregnancy, development of the fetus outside uterus. It is ectopic pregnancy. Infertility or even cancer of the reproductive tract may get seen. STDs are a major threat to healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care program. Though all persons are vulnerable to this infection, though all persons may get are subjected to succumb to these infections, their incidences are reported to be very high among persons in age group of 15 to 24. Is it my age group or your age group? Whose age group? Whose age group it is? It is your age group to which you belong. I am not telling this. It is given in your NCERT book. That is what I said. It is your age that wants to do something, because it is this age you get the most interest in that matter. And always it is at the risk of one's life. There is no reason to panic, because prevention is possible. Prevention is possible. How? How prevention is possible? How that one can avoid this getting STDs? How? Answer is going for some of the barrier methods. Going for the condoms, Nirod, etc. Only barriers, not IUDs. One could be free of this infection by following the simple given principles below. One should avoid sex with unknown partners, or one should avoid sex with multiple partners. Sir, it is not that she is unknown to me. She is my neighbor. She knows me. She is my classmate. Sir, I know her. She is my uncle's daughter. He is my aunt's son. He is my uncle. These are all unknown partners. Even if you told he is your classmate or she is your classmate, you may be knowing them very well. You may be knowing each other very well. But remember, as far as the sex is concerned, they are all unknown partners. Then who are the known partners? Who are the known partners? Known partners are husband to wife, wife to husband. Husband to his own wife, wife to her own husband. They are known partners. All others are unknown partners. Always, one should have one wife only. One wife should have only one husband. Multiple partners should be avoided. What is that multiple partner? A man having sexual contact with a number of women, there is a multiple partner, or vice versa. And if at all one is going to have sex, they should avoid or they should use condoms during coitus. Suppose there is some manufacturing defect in the condom. Can you go to the court? Who will keep the condom with them? Because this will be known after a few months or after a few days. Is it that the sexual partners are going to store those devices? No. That's second. Always one should use condoms during coitus. Even though it is said like that, we cannot best issue 100% issue that this is 100% safe. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with the disease. One should go to a qualified doctor. But can you go to a doctor and tell, doctor, I did like this and I am having this problem? No. Please remember, these doctors, I am not telling all doctors, there are certain quick doctors. The moment you may not go to the well-qualified doctor with regard to this. Even if I don't go to doctor, do you think that the problem gets solved within 15 days and 1 month? No, never. It requires months together, years together. Can you keep all these secrets from your parents? Who is going to finance you? Who will bear the expenditure pertaining to this? None. So, one should go to a qualified doctor There are so many quack doctors who tell that they put that advertisement and all. We treat that, we treat this and all. So one should go to qualified doctor for early detection and get complete treatment. As I told you, complete treatment requires many days, many months if diagnosed with the disease. Therefore, this very serious disease, one should be very careful if at all one advances with regard to this matter in its early life. Now let us look into infertility. What is infertility? You know, couple not getting the children. But who is generally blamed? Diti? If the couple does not get the child, who is blamed?
The lady or the girl.
Wife. Mother is cursed, but not the father. Not the husband. In our society, that is the fact. But the problem may be with the father also, husband also. Problem may be with the wife also, or problem with the both. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sexual cohabitation. What do you mean by this? Unprotected sexual cohabitation means they live together, they get into sexual contact without any protection to prevent the fertilization, to prevent the conception. They are not going for any family planning devices. Without any family planning device, even if at all they get into sexual contact, into coitus, without using any of these barriers, without using any of the family planning devices, they are not going to get to the children. That is what we call infertility. So you'll be asked, what is infertility? Infertility is a couple unable to produce children in spite of unprotected sexual cohabitation. As I told you, if you want to get good marks in biology, all these you have to write, only these you have to write. Now the question is that, why that couple remain infertile? What is the purpose of this infertility? Right? The reason for this infertility could be many. Physical, that is some problem with the genital organ. Congenital, some problem right from the birth. Many times, the baby will be born, female baby will be born with the defective uterus, with the defective oviduct, with the defective ovary. Right from the birth, before the birth. This physical is also same way, some defect in the genital organ. In case of men, there may be penis. Always penis will be limping down. Whenever a man is not sexually excited, the moment a man is sexually excited, he should get erect. He should get straightened. And he should become rod-like. In many men, it will not get raised at all. It will not become solid. It will not become rod-like. It will not get raised. Or even if it will get raised, it will not be solid enough to get introduced into the vagina. Many times, it will not get ejaculated at all. Many times, this raised penis will not remain raised for a long time so as to till it is introduced into the vagina, immediately it goes back. So these are all a physical defect. In many of the women, even the vaginal canal may not be proper. There may be defect in the cervical region. And some of these all defects may be right from the birth or maybe occurring afterwards. Some diseases, as you know, they also result in infertility. Drugs, extreme excess use of the drugs, immunological or even psychological. Psychological situation may also responsible for this, right? In India, often the female is blamed for the couple being childless. But more often than not, the problem lies in a male partner also. Specialized healthcare units, that is what is called infertility clinics, could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. Of course, there are some treatment. It depends upon what type of problem this couple face. However, where such corrections are not possible, if it is not at all possible to get it repaired, the couples could be assisted to have children through certain special techniques, commonly known as assisted reproductive technologies, what is called ART. So sometimes you'll be asked the question, what is the full form of ART? Assisted reproductive technology. Or you may be asked, what is assisted reproductive technology? Assisted reproductive technology are the technologies which are used for the childless couple to get the children by some sort of treatment to their problem. So, these, whatever that you already seen, some of the problems are corrected. Not all. Where such corrections are not possible. That means, if these particular things, whatever you have seen already, you have heard about that. Now let us see that. A particular man, he will not get his penis raised at all, erected at all. Problem, the man is getting the penis straight enough and solid enough. But we do come across sperm formation, 100% proper in him, viability of the sperm also, motility, morphology, everything perfect. You know, already you heard about that. If all these are perfect, only problem with regard to that man is just that his penis is not getting erected and he is not in a position to introduce it into the vagina. Then what can be done? We can go for assisted reproductive technology where we can take the sperm from his body, from the testis, and introduce these sperms into the vagina or the uterus of his wife. That is what is called assisted reproductive technologies. So, if at all, now you cannot make that penis again to get straightened like that. No, it is not possible. Gone case. But we still, even he can get the child from his wife with his own sperms. I hope you understood this point. Clear? Hello.
Yes, sir.
Yes, sir.
In vitro fertilization. What is that? In vitro means, always remember, in vitro refers to test tube. In vitro fertilization, that is IVF. Full form is in vitro fertilization. Fertilization outside the body in almost similar conditions as that in the body, followed by embryo transfer, is one such method. Is one of such methods. IVF and ET. That means we may collect some of the ova and put it here. And we collect the sperms, also put them here. And we can make these sperms and ova to meet each other, and the ovum gets fertilized by the sperm. Zygote gets formed. After that, this zygote, what we refer as embryo, this zygote or embryo is transferred into the female reproductive system. Of course, the wife's ova, her husband's sperm, that made to get fertilized, because the problem is with regard to fertilization. For that purpose, after that gets fertilized egg, zygote in different stages, of embryo development can be introduced into the oviduct or to the uterus. In this method, popularly known as test tube baby program, ova from the wife, if the ova is not proper in that wife, from other donor, ova from the wife or other donor, and sperms from the husband, if the husband's sperms are not proper from the donor, are collected and are induced to form zygote under simulated conditions in the laboratory. This is what I said. In the laboratory, the sperms and ova are made to meet each other and to form the zygote. It may be the ovum of that wife and her own husband's sperm, or if her ovum is not properly formed, other's ovum and her husband's sperm, or if her husband's sperm is not properly formed, some others, of course, there is what is a sperm bank, and the sperms are available in the sperm bank. So this is what is done during the in vitro fertilization and embryo transfer. The zygote or early embryos, zygote is the one which a sperm fuses with the egg and forms zygote. Or early embryos, zygote divides and forms. So 2-celled, 4-celled, 8-celled. The early embryos with up to 8 blastomeres, 1 becomes 2, 2 becomes 4, 4 becomes 8, up to 8 blastomeres could then be transferred into the fallopian tube. Whenever the embryo up to 8 blastomere stage is introduced into the fallopian tube, we call it a ZIFT. What is that? Zygote intra-fallopian transfer. ZIFT. And embryos with more than 8 blastomeres, are transferred to uterus. And this is what is known as intrauterine transfer. IUT, to complete its further development. Understood? So, you must know, if it is up to 8 blastomere, it is zipped. Zygote intra-fallopian transfer. Okay? With more than 8 blastomeres, it is intrauterine transfer. With more than 8 blastomeres into the uterus. Up to 8 blastomeres into the fallopian tube. Please know the difference. Okay? To complete further development. Embryos formed by in vivo fertilization. What is that in vivo fertilization? In the actual, in situ. Embryos formed by in vivo fertilization, fusion of gametes within the female, inside the female body, in situ, inside the female body, also could be used for such a transfer to assist those females who cannot conceive. It is not that we have to bring everything in the petri dish. Even this can be resulted in vivo. Embryos formed by in vivo. That means into the oviduct, if there is oviduct, in that oviduct, we can make that in the oviduct only, the sperms and eggs meeting. That is possible. Embryos found in vivo fertilization, fusion of gametes within the female body in the oviduct, also could be used for transfer to assist those females who cannot conceive. Right? So this is in vitro and in vivo fertilization. Transfer of an ovum collected from a donor into a fallopian tube. Transfer of an ovum collected from a donor. That is the third person. Into the fallopian tube is known as a GIFT, gamete intra-fallopian transfer. So in the gamete intra-fallopian transfer, it is the ovum. Ovum is a gamete. Transfer of an ovum collected from a donor. That means that woman has a problem. Woman has a problem with regard to production of ovum. When a woman is facing the problem of producing her own ovum, someone's ovum is put into the fallopian tube. And this is what is known as GIFT, gamete intra-fallopian transfer, of another female who cannot produce one but can provide a suitable environment for fertilization and further development is another method attempted. So here, I hope it is clear to you. Here the problem is that when one woman, she is not in a position to produce her own ovum. But in all other respects, she is perfect, all right. So at that time, some other woman's ovum is brought and put into her oviduct, made to get fertilized by her husband's sperm. And later, after fertilizing gets over, her uterus is very perfect to bear the pregnancy. So this is another method attempted. I hope you have understood. Clear? Have you understood?
Yes, sir.
Right? Now, Kumar, are you there?
Yes, sir.
Yeah. Intracytoplasmic sperm injection. Intracytoplasmic sperm injection, ICSI, is another specialized procedure. Intracytoplasmic sperm injection means you will get this ovum with a needle. You are just introducing the sperm here with a needle. It is intracytoplasmic sperm injection, ICSI, into the cytoplasm. Intra means inside the cytoplasm. Intra sperm injection is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. This ovum, this is the needle, and this is the sperm. Sperm is introduced. Okay. Infertility cases, either due to inability of the male partner to inseminate the female. Inability of the male partner to inseminate the female means the same thing, whatever I said. His penis may not get erected. It may not remain in the erected stage for a long time. He may fail to introduce it into the vagina of his wife. Or sometimes even after introduction, he may not get discharging the sperm there, semen there, ejaculation, or due to very low sperm count. Sometimes what happens, very low sperm count in the ejaculates could be corrected by artificial insemination, AI technique. Artificial insemination. That means, as I told you, I will show you, there is some time. Yes, I will show you that what is done through some other gadget. What is called catheter. We introduce a catheter into the vagina, and into the catheter, this particular, some other, that either that husband's sperm or some other sperm is made to, the sperms are made to pass. Infertility cases, either due to inability of the male partner to inseminate the female or due to low sperm count. Husband's sperm count is low, so some donor's sperm count. From donor's sperm, it is utilized, could be corrected by artificial insemination, AI. So if at all you are asked, what is ICSI? What is AI? You should know the answer. In this technique, the semen collected either from the husband, because husband, only his problem is that insemination, but the sperms are there with him. The sperm semen collected either from the husband or healthy donor, because there is no very low sperm count. Healthy donor is artificially introduced either into the vagina or into the uterus, and we say that IUI, intrauterine insemination. That means semen is introduced into the uterus. Intrauterine insemination of the female. Have you understood this? Do you have any doubts? Is it clear?
Yes, sir.
No
Yes, sir.
doubt? Okay. Though options are many, all these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. You know, for all this, sometimes expenditure comes to lakhs together, 4 lakhs, 5 lakhs, 6 lakhs, etc. Therefore, these facilities are presently available only in very few centers in the country. You know, who is the famous IVF doctor in Bangalore? Jyoti?
No, sir.
No? Rakesh?
No, sir.
No, it is Dr. Kamini. Dr. Kamini. She is the most famous IVF specialist in Bangalore. So, obviously, their benefit is affordable to only a limited number of people because it is quite expensive. More than it, emotional, religious, and social factors are also deterrents in the adoption of this method. Many times, wife knows that problem is with her husband. Wife knows very well that husband will not get erected. But emotionally, she is bound and she cannot give up her husband. Can she tell with all of this, I am perfect all right, but my husband is not perfect? The problem they got to my husband. But husband does what he does. Husband, if at all he finds that that woman is not conceiving, he may go to get a second marriage. But most of the time, woman will not give her husband, will not give up her husband, and she suffers. Everyone blames her for being childless. But she knows that the problem is with her husband, but she keeps quiet. That is why woman is great in India. I hope you understand my point, Aditi.
Yes, sir.
Woman will not give up her husband that much easily. She will not tell that my husband is important. And sometimes religious people think that it is God's decision. And one or the other day, God is going to give the child. And there are many social factors also. No one is ready to go to doctor, and every time it will become talk of the town. Everyone will come to know that she is not getting conceived. She is going to doctor. Her husband is going to doctor. Like that. And all the social factors also deterrence in the adoption of these methods. Therefore, childless couple always they do not go to doctor immediately to get their problem solved. Since the ultimate aim of all this procedure is to have children, in India, we have so many orphaned and destitute children, those who are without any proper caretaker, the children which are left unparented, who would probably not survive till maturity unless taken care of. So, our laws permit legal adoption, and it is as said one of the best methods for coupleless looking for parenthood. Many times, many times these couples they adopt one or the other child and they find some sort of a happiness in that. Understood? Okay. So this is with regard to what is called the reproductive health. Have you understood this? Any doubt you have? Any doubt you have?
No, sir.
No, sir.
No? No doubt?
No, sir.
Kumar?
No, sir.
Right? Okay. Right. Now, I would like to show you some more additional slides pertaining to this. And in my next class, you might have seen the timetable. In my next class, I'm going to take up some other topic. Okay. Now let us take up.
Sir,
Yeah.
I have a doubt regarding last chapter, sir. Shall I ask at last 10 minutes, sir?
Last
10 minutes.
Okay. Okay. Now I would like to show you little bit additional information on this. Are you seeing this slide?
Yes, sir.
Yeah. What is it written?
Rhythm method or calendar method?
Yeah. On the other day, I have told you about this calendar method. Am I right? Abstinence. The calendar method is also known as the rhythm method. Calendar method is otherwise known as the rhythm method, also known as the physiological method. Please add to that. Right? Rhythm method, calendar method, or physiological method, or abstinence, they are all one and the same. And I have already mentioned about this. This I have shown 14th day is ovulation day, and one should be very much careful right from day 10 to right from 20 if one does not want to become pregnant. And this is generally considered safe period, 5th to 9th, and here 21st to 28th. Right? Now, one thing I wanted to tell you, if at all, I don't know whether you are aware, whom you see here, this is the baby of this girl, Diti. Peruvian, 5-year-old Lena Medina, accompanied by her 11-month-old son, Gerardo. This is Gerardo. And who is this? This is the doctor who did that, attended her son's birth. Okay? This is the youngest girl on record to become pregnant. When her child was born by cesarean in May 1939, Medina made medical history and is still the youngest known mother in the world. At the age of 5, she got the child. How it is possible? Generally one gets menstruation at the age of 10 or 11. Until then, there will not be any fertile womb or primary site or secondary site. Right? This girl she gave birth to the baby in 1939 when she was 5-year-old. That means she must have got her cycle at least 1 year before. Am I right? Because there is a requirement of 9 months of pregnancy. Understood? Later, when it was doubted, who must be the father of this baby? The doubt was on her father. Whose father? Lena Medina's father. And even he got arrested. Now that you are reading the news and newspapers and all, father raping her own daughter. Like that, at that time, suspicion was there on her father. Even he got jailed. But later, it was proved that he was not at all responsible for that. But unfortunately, father was put in jail, and the case went on getting hearing for several years. Ultimately, he got released. He was freed from that allegation. And this girl did not tell at all who is responsible for that throat. And her son, Guru, believed that she is his sister. And later he came to know that it is not his sister, she is his real mother. Okay? Please remember, such things, don't think that it happened only in this particular Peru. These things are happening nowadays in India also. The children of the age of about 2.5 years, 3 years, they are getting now their periods, menstruation. There are many such cases reported from Bangalore, Mysore, Davangere, Hubli, Mangalore, etc., etc. Right? In one of the cases, when a 5-year-old female baby got her menarche, mother committed suicide and father became mad. What about that particular baby? What about that particular child who got the menstruation? Who will care about her? None of them are now there to take care of her. And treatment, if at all one goes for that, which has to be continued till the age of her natural menarche, maybe another 5-6 years. Every month it requires 5,000 rupees for the treatment. Every month, remember how much a treatment how much one has to spend for the treatment for that many years. These are the things that are happening. Now, if at all ask me the question, sir, why it is happening? Science has no answer. It is telling that the present day lifestyle, present day junk food, present day the different types of food that are consumed by these children are in one or the other way responsible for this precocious puberty. One getting puberty much earlier during the lifespan. So we must be very much careful while we consume the food that is available in the market. Don't think that all these food are good for our health. Right? Now let me just go to another point. This all I have told you. Coitus interruptus, lactation, amenorrhea and all. What I wanted to show you are some of these barriers which are used in this family planning. This is what you have the neuro. You know that here, this particular structure is rolled onto the penis, and soon after the coitus gets over, the semen gets collected here. And this is what the condom used by women. It is introduced into the vaginal canal. This is the vaginal canal, this is the cervical region, and this is uterus. It is introduced there. It is closed here. Closed end. Don't think it is open. You can see it. It is closed here. And that can be introduced by the woman herself. This is a female condom. And this is a male rolled up condom. Right? Now looking into the barrier method, this is what I wanted to show you, the diaphragm. Diaphragm. It is placed like this. The diaphragm fits over the cervical. This is the cervical region, lower part of the uterus, over the cervical opening, preventing sperm from entering the uterus. Right? Sometimes, to be on the safer side, women apply some contraceptive jelly onto the both the sides. And this is what you have the cervical cap with the contraceptive jelly. And then it is placed here. What will happen? What is the advantage of this contraceptive gel? It is a spermicide. It is a spermicide. Spermicide is applied there. Now, what is happening is that in this, look here, this is what the spermicide you have. This is the cervical cap. This is put in the cervical region. Now, the penis hits from here during this coitus. This is spermicide. By chance, that woman doubts. Suppose the sperm make an entry, somehow they pass through the sides of this cervical cap. If the sperms come here, if the sperm somehow come here, you know, when the penis pushes this, the spermicide gets spilled over here. By chance, if at all some sperms, naughty sperms, make some entry somehow, if they come here, because of this spermicide, they get killed. This is ensuring double safety. I hope you understand my point. Right? Now let us look into certain intrauterine devices. This already I have showed yesterday. Lips loop. This is a copper T. Multi-load copper 375. Okay, these are copper releasing IUDs. Right? LNG20 it is. Hormone releasing IUD. Right? Now looking into the chemical contraception, oral pill and all. I have told you about oral pill. You please remember, nowadays oral pills are available in two forms, 21 pill, 28 pills. In this 28-day pill, 28 pills, 7 pills are simple tablet without any hormone, and they are known as placebos or sugar pill. Why then? Why it is so used? You know, in a woman who gets her menstrual cycle of 28 days, she has to remember on 21st day she has to stop it, wait for her menstruation to occur, and another 3-4 days, again she has to start it. And you know that generally women are heavily loaded with one or the other work. So instead of just giving much care to remember when to stop, when to start, this pill a woman has to take every day. She need not bother. All the 28 days she takes. So in this 28 days pill, only 21 tablets have the hormone, and 7 tablets are without any hormone, and such tablets are called placebos or sugar pill, and there is no impact at all. Even if you want to take, you can take. Nothing happens because there is no hormone. These pills serve as a reminder to take the pill every day. That's all. I hope you understood my point. Right? So this is what I have. 28 days pill, Mala D. All these, first week, second week, third week, and this last one is just to see that it is not missed. Have you followed me? Yes, or no?
Yes, sir.
Jyoti, are you there? Hello?
Yes. Yes, sir.
Okay. So I have told you about implants on the other day. Implants are like that. Simple implants are nothing but they also contain the progesterone estrogen hormone. Slight cut is made, skin is removed, and just planted there, and again stitch is put. See? Once placed for another 2 to 3 years, she need not bother. She will not get pregnancy at all if she goes for unprotected sex. Emergency contraception. I have told you on the other day, yesterday, that these emergency contraceptions are nothing but progesterone or progesterone-estrogen combinations, or IUDs placed within 72 hours. Also, they serve as emergency contraceptive and they prevent that woman by becoming pregnant. We also have certain tablets. The drugs used for treating emergency contraception. If at all a woman gets into sex and later she realizes that she is likely to become pregnant, then immediately, the very next day, she can go for what is known as morning after pills. Morning after pills. Of course, one should not take these pills without informing the parents and doctors. So here what happens? 2 oral tablets to start and 2 tablets after 12 hours provide relief. But there will be heavy bleeding. If at all any girl makes an attempt to take that tablet without informing the parents, she may get into some sort of giddiness and unconsciousness. And if this matter is kept as a secret, doctor will not be knowing that what has happened. Finally, of course, the doctor will come to know that she has taken these tablets. Examples for morning after pills are Noral, Norgainon, Ovidon. Unwanted 72 is the most famous morning after pill. It is taken just to prevent one from becoming pregnant or to see that one is not getting implanted with the blastocyst. Right? Vaginal spermicides. There are many sperm-killing chemicals in the form of foams, creams, jellies, suppositories. What is that suppositories? It is a solid bullet-shaped preparation. Let me show that. And this suppository, bullet-shaped one, this suppository is placed inside the vagina. Because of the temperature, it melts. This suppository melts. Because of the temperature of the vagina, it melts. And after that, if at all one goes for sexual contact, nothing happens. The sperms get killed. Time methods, I already told you about that in yesterday's class. This is what is done. And whenever this vasectomy is done, it should be done on both the sides. Both the sides should be cut, not only one side. And tubectomy, this is one more thing that I wanted to tell is that apart from these two, we have what is known as a laparoscopic technique. What is this laparoscopic technique? Most of the women are going for this rather than tubectomy. They go for laparoscopic technique. In this laparoscopic technique, what is done? See, just near the navel, some incisions made. Just above this vulva, some incision made, and you can see that through these incisions, now they just introduce the laparoscope, they introduce the forceps, and also the light and all, and they can trace where is this fallopian tube, and after tracing, they put, see, they have traced this fallopian tube, and a ligate is put, a knot is put on this. On both the sides, they have to put this. Laparoscopic tubal ligation. The tube is ligated, just like putting a rubber band. And whenever that woman wants to become pregnant later, this can be removed and leave it. She may get again conceived. So it is one way, it is more safe. And the removal of gonads is the ultimate method. If at all gonads are there, then only they produce the gametes. If the gonads are removed, if the uterus is removed, that is the ultimate. So remember, the removal of the testis is called castration. Please note down. Removal of the ovary is called oophorectomy. And removal of the uterus is called hysterectomy. These are three terms you must know. Castration, you might have seen that in cattle and all, their testis is macerated by keeping them in between the two wooden flanks. So removal of the testis is called castration. Removal of ovary is called oophorectomy, and removal of uterus is called hysterectomy. Please remember these are three terms. Over, shall I go ahead? Diti? Kumar?
Yes, sir.
Over? Rakesh?
Yes, sir.
This is what you have, hysterectomy. See, here only uterus is removed. Here, uterus plus cervical region is removed, total. Here, everything is removed. Many times, a woman comes across with the cancer of the uterus. And a doctor will see whether it is spread to the other part of the reproductive system also. At that time, everything has to be removed. Sometimes the cervical cancer is the most common cancer found in India, and many women die of that. And when the cervical cancer is seen, if immediately that the cervix is removed, uterus is removed, no problem. If it is left unanswered, if it is left unattended, it starts spreading to other parts. From later, it becomes malignant and it may kill the woman. Right? This medical termination pregnancy, already I have told you about that. Amniocentesis. This is what is done during amniocentesis. I said that a needle is put to draw this amniotic fluid, then that amniotic fluid is processed further, cultured for biochemical study and karyotype analysis, right? So this is with regard to some addition points. Let me also give you a little bit more. Yesterday's and infertility. What is this? Already I have told you about this, but this is a little bit more. You know, yesterday's sexual transmitted disease, already I have mentioned about that. And what I wanted to tell you is that the disease causing organisms are mostly bacteria and viruses, which are usually transmitted during sexual contact. Right? Yeah. Let me give some information with regard to gonorrhea. What is gonorrhea? Gonorrhea is the infection caused by bacterium Neisseria gonorrhea. Neisseria gonorrhea. Please know that. It is caused by bacterium Neisseria gonorrhea. You know in Kannada, Neisseria gonorrhea. If you get in contact with the STD suffering person, you will get gonorrhea. Neisseria gonorrhea. And affects both men and women, transmitted through direct sexual contact. May be transmitted even to a newborn baby during birth from infected mother. This is what you have. The bacterium Neisseria gonorrhea. Symptoms. Symptoms appear about 10 days after infection. If at all, a boy goes into contact with the STD suffering a girl, within 10 days the infection appear about 10 days after infection. Symptoms in men include severe burning sensation in penis during urination. When he goes to pass the urine, he gets some sort of burning. Of course, burning sensation one boy may get due to some other reason also. Unless one has gone for the sexual contact, one need not worry about that, whether he got this gonorrhea or like that. If he has gone for a sexual contact, then one has to definitely take this seriously. Severe burning sensation in penis during urination, more than it, very important, asked in the examination previously. A greenish yellow discharge called gleat comes out to the penis. Is the severe burning sensation. Note down gleat. A greenish yellow discharge oozes out from the penis. Greenish yellow. If this is the scenario, definitely that boy has to know that he got infected. Okay? Now, shall I go ahead? Symptoms in women include severe pain during urination, discharge of pus from vagina, pain in the lower part of the abdomen. But these are all generally a woman will face when she has a period. During her periods, when she gets her menstrual flow, menstruation. During her menstruation, of course, there will be pain during urination, discharge of pus, she cannot make it out, and pain in the lower part of the abdomen. So, these symptoms may remain ignored. And these are other effects. Patients of gonorrhea suffer from urethritis, cervicitis, arthritis, inflammation of the lining of the heart, and gonorrhea may also lead to infertility. This is with regard to gonorrhea. Prevention. What is the prevention? As I told you, multiple sexual contact should be avoided. And condom may be used. If at all anyone goes to have the sex with some other person, condom has to be used. But again, no guarantee of 100%. And treatment doctors always give penicillin, most effective drug. Other antibiotics are erythromycin, tetracycline, spiramycin, etc. This is what generally used to treat this gonorrhea. Right? Now, let us look at another one. Another sexual transmitted disease more dangerous than gonorrhea, that is syphilis. Infectious disease caused by bacterium Treponema Pallidum. The bacterium which causes syphilis is Treponema Pallidum. Affects both men and women. May be transmitted even to a newborn baby during birth from the infected mother. What is most important? This is the Treponema Pallidum, which it is a bacterium which causes the syphilis. Symptoms progress through following 4 stages. There are 4 stages of symptoms. Please remember, in the first 1 or 2 stages, the symptoms disappears on its own. We say first one, primary stage. Symptoms of primary stage usually appear between 14 to 28 days after infection. After one comes in contact with the sexually transmitted disease having individual. Chief symptom is appearance of a painless localized ulcer or an open sore called a chancre. Remember this word, chancre. What is chancre? It is a wound, but without any pain. painless, localized ulcer, or an open sore called chancre around sex organ, or anus, or around even mouth. Right? They are painless. That is a very important surprise thing. The wound is there, no pain, and soon disappear without going to the doctor. That is the pathetic part. One will start worrying, but within 2-3 days, he starts to stop worrying because it disappears. So this is what I have. The wound in the glands, chancre in the glands, Gaia, chancre in the glands. This is what I have the chancre on the penis region. So you can see that this is the vulvar region of the woman. See, vulvar chancre. And even one may get this chancre on the digits, or even on the inner side of the lips, or even on the armpit area. Right? These are all chancres, painless, sore. Second stage. Symptoms usually appear 6 to 24 weeks later. That means after 6 months. 1.5 months to 6 months. Symptoms include skin rashes, fever, body aches, and pain in the muscles and the joints. So, these second stage symptoms, also we call it later stage. Second symptoms disappear temporarily. Again, I am telling, they disappear temporarily. This symptomless period, latent stage or latent syphilis, it is called latent stage. During this period, bacteria may invade body organs. This stage may also last up to 30 years. It may remain. And it gets cured also without going to doctor. Second stage symptoms of syphilis. The moment one goes to doctor, doctor starts doubting. Something unexpected, unusual things have happened. Second stage symptoms of syphilis. And this may appear at any time after 24 months, up to 30 years. By the time he gets married, from him it goes to the wife. And if that wife becomes pregnant and gives birth to the baby, it goes to the baby. Imagine the situation of that family. Second stage symptoms on the tongue region, right? Tertiary stage appears between 1 to 30 years after the latent stage, referred to as the late syphilis, tertiary stage, right? So effects, it may attack the nervous system, result in blindness, partial paralysis due to nervous disorder and loss of memory. Patient may become irritable and develop hallucination, and the patient may suffer from unable to control urine and bowel movements, incontinence. Patient may develop liver and heart diseases also. Treatment remains same as that of the gonorrhea. One should avoid multiple sexual contact. One should always use a condom. And treatment is the same. Penicillin, erythromycin, tetracycline, pyridomycin. Now, let us just, of course, this infertility. I have already told you about infertility. And let me just leave this. Yeah. You must know these terms. With regard to infertility in case of human being, oligospermia, deficiency in the sperm count. Normal sperm count is expected to be 50 to 150 million per ml. But in a man, if the sperm count is less than 20 million, he is considered as infertile. So normal count that should be more than 20 million per ml. It may be 50 to 150, and a sperm may come out to the extent of 3 to 5 ml. So oligo means a few. Oligospermia, less sperm count, less sperm in 1 ml. Per ml, there should be at least 20 million sperms. to be fertile. If it is less than 20 million, it is considered infertile. Azoospermia, complete absence of sperms in the ejaculate. Azoospermia. Asthenospermia, condition in which male has a poor sperm motility. Please note these three terms. Azoospermia, A means absent. Complete absence of sperms in the ejaculate. That means in the semen, which comes out. Asthenospermia is condition in which male has poor sperm motility. Understood? Shall I go ahead? Hello?
1 second.
Hello?
1 second, sir. I'll read.
Jyoti,
Yes, sir.
any doubt?
No, sir, I'm just writing it down.
Kumar,
He left, sir.
over?
Yes, sir.
Yes, sir.
Okay. Okay. So, causes of infertility in women, there are many. Okay. Assisted conception, already I have told you about that. So, this is what I said. Whenever a man cannot get his penis erected, his sperm can be introduced into a gadget, what is called a catheter. Sperms from husband are injected into the uterus of human using suitable device. We call it catheter. And the sperms are put here and that they will come here. Because man cannot get his penis straight enough. He cannot inseminate. If it is her own husband, then it is called artificial insemination, homologous, AIH. You know, AI is artificial insemination, introduction of the gametes through some other devices into the body of the female. Artificial insemination, here the sperms are collected from donor. That is artificial insemination donor. Other method remains same. Through the catheter, the sperms are put into the vagina or into the uterus. In vitro fertilization, I have already told you about that. Test tube babies. What I wanted to give the information, this is the first test tube baby of the world, Louis Joy Brown. She was born in 1978. This, of course, it is her bit grown up photo, not the baby when she was. First test tube baby, you must know that first test tube baby of the world is Louis Joy Brown. This is the lady, this is the baby. Now it is grown up. Born on July 25th, 1978 in England. Louis Brown, whose birth as the world's first test tube baby in 1978 was worldwide sensation, has given birth to her first child conceived naturally. She gave birth to her baby, and that baby she got by natural way. Okay? So, whom are these? This is what the first test tube baby, and this is her son, and this is her mother, and this is a doctor who has conducted that test tube baby experiment. That is Edward. Edward, who developed the test tube fertilization, has received Nobel Prize in 2010. And Robert Edward died in 2013. Look here, for the experiment he has done in 1978, he got a Nobel Prize in 2010. So late. Of course, there are two, you must know that. There are two doctors involved in that. I tell you. July 25th, 1970, the newly baby entered the world under the notable circumstances. Okay. The procedure involved extracting an egg from Louis's mother, mixing it with the father's sperm, Louis' father only, and adding solution designed to promote cell division of the zygote. After 2 days, fertilized egg was placed back into the mother's uterus. The pregnancy progressed normally for 9 months, and the baby was born by cesarean. Okay. While the procedure still brings ethical debate, approximately 3 million babies were born since 1978 by test tube baby technique. Even though it was conducted in 1978, 3 million, thereafter, 3 million babies were born by this method. This is Louis Brown with their father and mother, 2003 photo. And these are the two scientists. This is what Patrick Steptoe and this is Robert Edward. These two scientists got involved in this particular experiment. Only Robert Edward got the Nobel Prize, but not Patrick Steptoe, because Patrick Steptoe died before 2010. So Nobel Prize is given only the person who is alive. So Robert Edward got the Nobel Prize in 2010, but in 2013 even he died. If they are not given the Nobel Prize at that time, he would have missed this Nobel Prize, even Robert Edward. But what is most important is, this is the girl, first test baby of India, Kanupriya Agarwal. She was nicknamed as Durga. Remember, this girl was born in 1978 in October 3. And Louis Brown was born in August. She was born in July 25th. And this was born in October. That means the creator of this Indian's first test baby, Subhash Mukhopadhyaya, he did the experiment when Patrick Steptoe and Robert Edward, they did the experiment. At the same time, this Subhash Mukhopadhyaya, he also did without knowing what they were doing. Am I right? Don't you feel that he also should have given the Nobel Prize? Am I right? Am I right? Jyoti?
Yes.
Because they, Rakesh, because they have conducted the experiment almost at the same time. It is not a copy of each other. But what happened, What happened, Look here. Dr. Subhash Mukhopadhyaya. Dr. Subhash Mukhopadhyaya created history when he became the first physician in India to perform in vitro fertilization, resulting in the test tube baby Durga on October 3, 1938. Facing sociological bureaucratic negligence and insult, instead of recognition from the West Bengal government and refusal of the government of India to allow him to attend international conferences, he committed suicide in his Calcutta residence in 1981. His work was not appreciated. His work got condemned. He was insulted for doing that experiment. He was not allowed to go out from India to attend international conference. His fiat has been given belated recognition as the Indian physician who in 1986 was officially regarded as being the first doctor to perform in vitro fertilization in India. Had he been alive in 2013, he also would have shared the Nobel Prize with Robert Edward. See the fate. Right? Okay. So this is what is done otherwise. Embryo transfer and sperm transfer, allowing the fertilization to take place, and then putting it into the uterus. Right? All this I have told you now. Intracytoplasmic sperm injection. oocyte donation. And this is all. The oocyte is taken from one woman's body. Okay, you can see that. With the needle it is removed. And it is put into the petri dish where the fertilization takes place. And later it got introduced into the another woman. Now it is introduced into the body of another one. Embryo transfer. Okay. So later, sometimes some woman will come forward to bear the pregnancy. They are called surrogate mother. So that's all about today's class.